When you think of hyperbaric oxygen therapy, you might associate with scuba divers needing to decompress from deep water dives. The therapy has dramatically expanded, and now it's used for all kinds of injuries, illnesses, and conditions. Dr. David Ajay joins us to talk about this therapy. So welcome.
Thanks, Ashley.
Yeah, thanks for being here. So you're joined with Sharon, you're a nurse, and Teresa, you are as well, but you're also the director of operations. So thank you guys for being here.
Thank you for having us.
Yeah, so hyperbaric oxygen therapy. Can you tell us what this is? This might be a new word for some people.
Yep. So in a nutshell, hyperbaric oxygen is two words, right? Hyperbaric and oxygen. Oxygen is a gas that we all breathe to survive. Hyperbaric means pressure, right? So it's pressurized oxygen in a tube, right, basically. So hyperbaric oxygen, the moment you pressurize the oxygen, you have a medication in your hand.
Wow. Sure, it's just a high dose of that. So what types of illnesses, injuries are we talking that this can help treat?
So we are talking about things like carbon monoxide poison. We're talking about things like diabetic foot ulcers, things like soft tissue radiation injury, things like sudden hearing loss, sudden, I call it stroke to the back of the eye. They call that central retinal artery occlusion, things like compromised flaps, compromised grafts. And that's just a little bit of things we do with that.
So you said like soft tissue, would that be like a concussion?
No.
Would that be something like that?
So, for example, if you have a patient that had prostate cancer in the past, and the prostate gland was taken out from surgery, and now they had radiation post-surgery. That radiation damages the tissue, right? So you have a damage due to radiation, and then you give, in that situation, if you give hyperbaric, you can help that tissue heal.
Okay, and it's like such a natural therapy.
Correct.
So what does the treatment actually look like?
Well, that's a good question. The treatment entails, it depends on the reason why we're treating you, right? So, for example, it might range from anywhere between 60 minutes to sometimes 5 hours.
Okay.
Right? And a typical case usually is diabetic foot ulcers, right? So it's 2 hours, right? And it's the patient comes from home, we come to our chambers, we examine you, we make sure that you don't have any contraband. And the contraband here is because in the hyperbaric chamber, it's a place that is highly flammable. So if it's 100% oxygen, so if you go in there with something that is a little bit can cause a spark,
sure,
you can imagine what's going to happen, right?
Right.
So and we don't want that to happen, right? So we get people, we pretty much have a little bit of OCD. You know, we have to make sure you don't have nothing on you that is contraband, and then you go into the chamber. The big deal.
Okay, there we have an image of the chamber. So here's like that chamber. That's what you go into.
That's
you lay
exactly
on there.
what you go in there, and when you go in there, all you need to do is relax. Usually, the first 10 minutes, we tell the patients that you'll have this pressure change where you have to clear your ears, right? Once you can clear your ears, that's all. The remainder of the treatment, you're just there, lying down. It is the easiest treatment in medicine.
Oh, that sounds all right. Yeah.
I call it a boring treatment because unlike surgery where someone is cutting you, or like chemo where you're getting chemotherapy that can be very bad to your hair or your skin, this is you just doing literally all you've done since you came to this world, breathing.
So what would you notice, after a treatment?
So depends on the diagnosis.
Okay.
For example, if the patient has carbon monoxide poison, and the problem is that they're having headaches, they're having nausea, they have an abdominal discomfort, after the treatment, those things go away, right? But if the patient has a chronic problem, so for example, soft tissue radiation injury, the wound has been there for a long time. You don't expect the wound to just get better after the dive, right? It takes repeated treatments, and then you begin to see the wound heal closely and it heals completely.
Sure. And you guys have a couple chambers, is that correct?
Yeah, we have 2 chambers right now. We have the first chamber in June, and we got a second chamber in October of last year.
Okay. And so now if people are interested in, if they have a need that might fit this, how do they get a hold of you guys?
Oh, yeah. We have a network where we have a referral system where you have to refer, a provider has to refer you to us. So we don't really take self-referral at this time. We've gotten a little bit of calls on that, but we try to tell them, hey, you got to go through a provider, and then you reach out to Essential Health, and then you can get a hold of us.
Okay, and I'm guessing this is a very it's a very specialized thing that you guys are offering. So not I hadn't heard about this in anywhere else in the area. So.
It is so there is hyperbaric in the area, right? But this is the first time we're having hyperbaric in a hospital-based practice, right?
Sure.
So, which means that if you have a need for hyperbaric in the middle of the night, we can come in and treat you, right? That's the difference now. You will have to go all the way to the Twin Cities or all the way west to Seattle to have something like that.
Wow. Well, you guys are paving the way, so thank you for sharing this with us. Thank you for being here. Appreciate all of you and all the work that you're doing. And I know you have some great stories of some patients that have really benefited from this, but yeah. Well, thank you guys.
Yeah, awesome. Thank you so much.
Coming up on today's show, healthy meals that are prepared for you ahead of time, how Profile Fresh can help jumpstart weight loss in the new year. Stay with us.